If you are suffering from infertility, whether you are 40 years or above, or whether your AMH is decreased, or your FSH is increased, or you are suffering from something called premature ovarian failure, or even if you don't get menses at all, you are suffering from amenorrhea, even if whenever you conceive you suffer from recurrent miscarriages, in all these situations, this is the supplement for you. And the thing is, this is beneficial not only for females, it is also beneficial for males. And spoiler alert, this is the cheapest form of this supplement. Let me know in the comment section below if you can find it any cheaper elsewhere, anywhere in the world. So let's begin. Assalamu alaikum wonderful people, I am Dr. Asma and the supplement that we are going to discuss today is DHEA. This DHEA that I have is in the form of 25 milligram pills, and I'll tell you how we use it, when we use it, what are the indications that we can use it, what are the benefits for DHEA for females, as well as what are the benefits of DHEA supplementation for males. So stay tuned till the end.
If you want to learn more about natural supplements and recipes of superfoods that will keep you away from all kinds of pills, injections and drugs that the doctor has to offer, do subscribe to our channel and click the bell icon right with it, because you won't find such information anywhere over the internet.
So ladies first, let's start with the females. In females, if you are suffering from insulin resistance is something which results into PCOS or PCOD. In that case, you need a very low dose of DHA supplementation. Like this is a 25 milligram tablet, you just need like half of it, 10 to 12 milligrams per day, once a day is enough. And your glucose tolerance will improve, your glucose uptake will improve, and you will no longer suffer from insulin resistance. Insulin resistance is also the basis for pre-diabetes, and most of the type 2 diabetes cases also. So it is helpful in those cases also, and in those cases it is helpful both for females as well as males. For females, however, the most important use for DHEA is the fertility. DHEA is a hormone which is naturally produced by the body. This DHEA basically converts into testosterone as well as the estrogen. So that is why it has benefits both for the males because of the testosterone and for the females because of the estrogen. And it has been seen that once the DHEA production decreases, that is after 30 years of age, your incidence of heart disease, your incidence of depression, your mortality overall, that increases. So it has also been called as hormone of youth because it produces all the things which are associated with youth, like high sex drive, vitality. If you are suffering from amenorrhea, that is to say lack of menses, you don't get menses at all, what we do is we basically supplement DHEA. For the first 14 days, that is the follicular phase, we take DHEA twice a day. Okay. And then from the 15th day to the 28th day, we take it thrice a day. That is to say 25, 75 milligrams per day. If you are suffering from premature ovarian failure, low ovarian reserve, any of these conditions, then we basically supplement it thrice a day. And the thing is, it is not only beneficial for spontaneous pregnancy, it is also beneficial in case of females which are going IVF.
ICSI or artificial insemination or any kind of assisted fertilization, it has been seen in patients of IVF, 25 patients, and they saw that after supplementation with DHEA, all of the fertility parameters improved. The live birth ratio improved, the egg quality, the embryo quality, even the spontaneous conception that improved after taking the supplementation with DHEA. So DHEA basically improves the female fertility. So this was a benefit which is specifically for females. Let's see the other benefits. So improvement in the bone density is a benefit that is experienced by both males as well as females who are taking DHEA supplements. And we all know that after menopause, most of the females experience osteoporosis. That is to say, they experience weak bones. So if the females are taking the DHEA supplements, this osteoporosis incidence that decreases. And this benefit of DHEA for bone density is more recognized in females than in males. DHEA supplementation also improves the muscle density, and this is because DHEA produces both estrogen as well as testosterone, and this benefit of improving the muscle density is because of the testosterone production, and this benefit of improving muscle density is more marked in males doing gym or going for bodybuilding, so it is a great supplement for bodybuilding. DHEA is also a great supplement for those suffering with depression or anxiety. Basically, it boosts brain. It is touted as a longevity supplement also, because basically what happens is DHEA is naturally produced in the body. With age, the production of DHEA decreases, and because of the decreased DHEA, you suffer from lower sex drive, increased incidence of cardiovascular diseases. In fact, overall, more mortality increases after the DHEA decreases. So, if we supplement with DHEA, all these parameters will improve. The sex drive will improve, the incidence of cardiovascular diseases will improve, and things like that. Having said that, we must all remember that DHEA is an anabolic steroid. Okay, steroids are not to be taken lightly. If you are taking this DHEA supplementation for a long period of time, then take months off. Like if you take 1 month, take 1 month off. Then the next month you take it, then take 1 month off. This will prevent the suppression of your natural DHEA production. However, lower production of your DHEA is, it will not stop producing DHEA altogether because external DHEA is coming. And although in some countries it is available as over the counter supplement, but in countries like Canada, this DHEA is not available like over the counter. You need a doctor's prescription to take DHEA. So I would urge every one of you to not take DHEA or any other supplement for that matter without the consultation of your doctor. Like we have seen, there are different doses for different types of deficiencies of DHEA. So do not take it lightly. Always take it under the supervision of your doctor. So let me know in the comment section below which of these conditions do you relate to, or are you willing to try it for your condition, and also let me know if this DHEA is cheaper in your area. So take care till we meet next time. Assalamu alaikum warahmatullahi wabarakatuh.